Hey everyone, so if you don't know me, my name is Jordy, and alongside Tree, who's doing all the behind the scenes and filming, we'll be hosting this new podcast series. So Tree came up with the name Transit, which is a reference to some of the topics we'll be covering, looking at how we live in the 21st century and how the world is changing. So I guess it seems topical to cover COVID in this first episode, and we'll be interviewing Owen, who's the head of ICU at Box Hill Hospital. Anyway, I'll let him properly introduce himself, and I hope you enjoy the interview. Just straight off the bat with some tough questions about yourself. So I'm just going to ask you, who are you?
Well, I'm your uncle, so just be careful about how tough the questions are. So I am one of 5 kids, and my older sibling is your mum, Karen, and my one of my brothers is Bevan, and so we're all part of the Ashburton church community, and then I have another brother in Sydney and another sister in Melbourne as well. So there's a whole bunch of cousins that you have that are all part of our kind of close family. I'm also a father of 2 boys, Chester and Frank, who go to church, and married to Sally, who's a GP and also part of our community. I am a doctor, among other things, and the professional part of my work is involved very much in intensive care. So I'm an intensive care specialist. I look after patients who need life support, and I'm also in charge of intensive care. So I'm the director of a number of intensive cares, and so I have a kind of a senior and management leadership sort of responsibility with how ICUs work. And in the current climate, that's been very publicised in the media relating to the response for the COVID-19 pandemic.
Okay, so the second question is, what's your philosophy?
My philosophy,
Yeah.
well, probably is not a generic thing. I think I have a philosophy for different things, my life philosophy or my work philosophy or my parenting philosophy or something. So I probably wouldn't think of a single philosophy. I have a pretty, cohesive Christian worldview, which informs my philosophies quite significantly and was brought up in that. So that's informed my values as well. And so values are often said to be things that are formed in the first 7, 8 years of life. And so they're very strongly, really linked with a very strong Christian ethic and a very sort of, Jesus defined kind of philosophy, if you like, or worldview. Um, and I think so. The elements of values, elements of worldview, and then on top of that, there's elements of my own character and personality that inform my philosophies. And so um, I'm very people centric. People are very important to me, and a lot of the decisions that I make are focused around how they help people and how they engage people. So that led me to choices about work and family and things like that.
Yeah. Yeah, so it seems like your philosophy has sort of an effect on your personality in different spaces. So maybe in when you're at work, you're sort of having to um, talk differently to people, I suppose, compared to when you're with your family or that sort of thing, I suppose.
Yeah, I mean, I think there's roles that you have in society, and I have certain roles. But having said that, I think that philosophy element, means that the way that I communicate at work is probably less impacted, as in compared with what I communicate. So I'm often able to impart part of my values and my worldview just in the conversations that I have with either patients or with staff or families, given that that's the context that I work that I work with.
Yeah. So since restrictions have eased, it seems like a lot of people have gone back to their sort of pre-COVID lifestyle. Um, so would you say we're past the worst of this pandemic yet? Or
Yeah. I, I reflect on this pandemic and I think back to what it was like before December when people in Australia didn't know what a pandemic was. And, the impact of the pandemic has had a huge emotional um, impact on people. And in Australia, much more emotional than actual. So it's a bit like, when we talk about fear, there's real fear, so when someone's in front of you with a knife versus when you read a media story about someone in another country who's been attacked by someone with a knife. And both those things can cause fear. But one we would say is a fear about something, whereas the other is a true fear of something that might harm them. And in that sense, Australia's lived through this more in that other type of fear, where what we're seeing is the international reports of what can be truly frightening and damaging. And we've escaped much of that. And so the impact in Australia has been felt emotionally and by the things that we've had to do to try and avoid the real problem. But what's interesting in that is that's a huge adjustment. And there are professions which address change management. It's considered to be something that's difficult to do, to get people to change. And yet we've had to change everything that we do in our society immediately. And so that comes with a massive impact emotionally. And we've seen and experienced that ourselves, and we've seen that amongst our family and friends and everyone in the community. And what that's led to is an immediate behaviour change, implemented partly because of people's own experience and fear, and partly because of legally implemented restrictions. And that's given a bit of time to both prepare for the pandemic, but also a chance for people to modify their expectations of life, so that people have come to terms with understanding things about statistics they never had considered before, things about exponential growth that they'd never considered before, things about the transmission of droplet spread diseases, things that they've never considered before, but at the same time, things that are of importance to them. So there's been an incredible amount of change in people's own personal and family circumstances and worldviews and the ways that they're thinking about things. At the same time, as we've seen the pandemic evolve across the world, and we've seen some countries suffer enormously with the burden of illness, people getting sick, and death. So people who've ultimately died because of the COVID virus. And we know that it's a real thing. In Australia, we've had a reasonably early response in terms of limiting the spread and in terms of contact tracing and the whole and quarantining. That's meant that we've been able to contain that that spread of disease. And now we're in this position where we're talking about either going back to normal or removing the restrictions. And there's been this almost change in the psyche of our own minds that has come to the point where we're now thinking about being over the pandemic. What we're actually experiencing is coming to terms with the very same data, the same facts that existed 3-4 months ago. We're not really in any different position in Australia to back then, other than the fact that, do you want me to move him out? So I think we've now come to a point where we are now where we were a few months ago, but with a different perspective on things. So when we're thinking about whether we're over the pandemic, it's categorically untrue to think that we're over the pandemic. In fact, we've never had the pandemic in Australia. And there's never been a better time to be a Victorian or an Australian as far as being safe in the world. I think the way that our governments, our medical advisors and healthcare services have worked together with the community, with the response of this, has been really quite um, amazing, really quite astonishing. And we've seen a collaborative approach, a bipartisan approach to this, which has been incredibly successful. We haven't seen the divisive politics that we've seen in other countries, which is actually still playing out in places like the States.
Mm.
But but to say that we're over it is clearly not true.
Mm.
There's no more immunity in the society than there was back in January when we first started having cases diagnosed in Australia. And in fact, so we're just as at risk as we were. We perhaps wash our hands a little better. We perhaps sit a little further from people, probably not far enough here. We have a little bit more concern about whether we go to work if we have a cold or a sniffle. There's some of those changes which will probably be ongoing. But when you talk about whether we'll go back to normal, I think that's something that's probably not going to happen for a very long time. I think it's likely that we're going to have COVID disease in our community probably for years. And until we have something like a vaccine, then I would be expecting that it's going to be years that we're going to continue to have some form of impact from COVID on our way of life, which will play out as we see outbreaks of disease.
Yep. And also, it seems like people have sort of had to adapt because of the circumstances. And you sort of, I mean, you sort of touched on this briefly, but you think that people have to learn how to change, but also in maybe other aspects of their life that aren't related to COVID.
Like what?
So maybe like climate change, for example, but there could be a number of other things that people sort of have come to the realization of, oh, we can actually change things. We just need to actually do something because clearly people have been able to adapt to COVID because we it seemed like we had to as the only option.
Yeah, so I wonder, do you think that even the Black Lives Matter might be actually an empowerment that's come out of seeing some capacity to actually make a difference even in the COVID response?
Yeah, yeah. There's been a lot of people with different views on whether they should be happening, but yeah, it seems like it's just because of yeah, it seems like they've happened because of COVID in some ways. Now, I suppose, yeah, even though it's been an issue that's been present for well hundreds of years, really. Yeah,
and thousands, probably.
Yeah, probably. Yeah,
probably forever. And
yeah.
I think that's kind of the disruption that we often talk about that's brought about by IT, you know, because IT in the last few decades has probably generated the biggest changes in the way that we work or the way that we interact or the way that we think. You know, the World Wide Web, we have connectedness, where all of those things have been disruptive in a way that we now have this thing which we call disruption. And it's often seen to be a positive thing because it allows us to evolve into, you know, a better systems, people, whatever. So disruption has been linked very strongly with IT related things, but I think this is probably a far bigger disruption, and it's about connectedness, but it's not about electronic ones. And I think that disruption is playing out now in a way that no one ever could have predicted anything to have been disruptive. And so, yeah, we've had a chance to rethink things that we haven't rethought for ever. So things like racism, which has been probably entrenched from the time that we were small tribal communities, you know, we were able to rethink in a powerful way. But at the same time, things like, you know, in my world, we talk about life support and end of life for patients, so people, often is presented out of the blue. So people don't necessarily know that they're coming up towards some life-ending experience, some disease that might take their life, and they end up in this position. And sometimes they lose capacity at that time to actually be involved in decisions about whether they want life support or not. And so one of the underlying presumptions, one of the assumptions that we all appear to share is that life is sacred and that life at all costs is important. And we see people at the very end of their life, often with well into their 80s and 90s, who have a huge burden of suffering around them. And what we're asked to do is address their life support without necessarily addressing the other questions about what's meaningful, what's important, because there's this underlying assumption, which is not often not spoken about even, that we just must save their life. And to challenge that often takes it's quite a shock for people, sometimes even the treating clinicians, because it's seen to be just um, a universal assumption that life is more important than any component of it. And yet, I think what COVID's done in that example is given us um, the impact or the disruption to actually challenge is that assumption, which is often based on that kind of traditional, perhaps the Judeo-Christian, but in fact many religions have this underlying truth that life is sacred and therefore life must be protected at all costs, and actually decide whether that's actually our priority. Um, because in the COVID era, we're exposing people to all sorts of risks by just proceeding with that assumption, not the least of which is the financial and economic risks. Because if we shut a community down with the assumption that life is the primary thing that we're trying to save, but 20% of people lose their jobs, we're actually having to now think about whether that's the right balance. So should we not um, uh, protest the Black Lives Matter because life is sacred and we're trying to stop people from dying from COVID or spreading this disease? And what responsibility do we have for the community versus a minority? And so they're all important things which we're given the impetus to challenge with the COVID restrictions, not by intention. We didn't design those rethinking opportunities. We didn't even want them.
Yeah.
And and yet they're some of the powerful things that are coming out of these things. The other thing I've noticed is just that people are really happy to lose some of the stuff that's become an assumed part of your life. And we talked before about weekend sport or after evening activities or certain meetings or even a church service. People are now actually questioning, should I have the choice about these? I perhaps wouldn't choose these to be the priority of what I would do with my time or my relationships or my interactions. And so, I think all of those are unintended consequences of this incredibly powerful impact.
Yeah.
I think to come back to that question though about whether we're likely to return to normal, I think what we're still in the middle of is changing our view about what normal is. So I think what we experienced up until December, if we call that normal, there will be no back to normal, because we won't go back to the way that things were, because this will not happen. And so what we'll end up with is a new normal, taking these things into consideration along the way. When the COVID outbreak happened locally in China and was starting to be publicised, the response in Singapore and Hong Kong was rapid and reasonably easy. From those people I know who live there, they simply said, well, there's another pandemic starting, and therefore we will do what you do when a pandemic happens, because they've been through it before.
Yeah.
And what we saw there with, particularly with the SARS virus outbreak, meant that the communities there actually have been through this change that we're going through, and they know what it means. And in fact, it was not a huge impact to them because they've considered it. I think this will set us up for the future for doing that. But that's the impact we're living through at the moment.
Yeah, because before now we sort of feel like, oh, we're just an island and we're separate to the rest of the world, but really everyone's connected in this day and age.
Aren't they?
Yeah.
We can talk about the cases if you want. I mean, at the moment, the US each day is getting more cases diagnosed than Australia's had in total. And the Australian prevalence of disease is almost all related to people still coming from overseas.
Yeah.
It's not
Yeah.
local spread. And so that's reassuring, but
Mm.
that's as a result of the changes that we've all made. There's
Yeah.
nothing special about our population or
Yeah.
environment or weather
Yeah.
or anything, other than, we're not living quite as densely as some
Yeah.
countries.
Yeah.
We have a fair amount of wealth and
Mm.
healthcare, so we don't have a huge amount of undiagnosed
Mm.
disease that would allow a massive pandemic to take over. But most of the virus in Australia at the moment is readily traceable, and that's reassuring. Not to
Mm.
be complacent about, but it's reassuring. But there's no reason why it couldn't be different if we behave differently.
Yeah.
And so we have that
Yeah.
responsibility to ourselves, but also to others. And the other thing is that in Australia, we have a pretty good healthcare system. So in terms of where people have died overseas simply because they ran out of um, ICU
Mm.
capability or beds or whatever, that's not likely to be the case. So that means that the people who likely suffer the most with this are people who are already at risk,
Mm.
already sick, already weak,
Yeah.
already frail, already old.
Mm.
And so in Australia, there's been almost no deaths
Mm.
from people under 60.
Yeah.
And even those over 60, most of them are over 70. And even those, most of them have some other
Mm.
disease which makes them a bit weaker.
Mm.
Now, that they're the people that we're trying to protect
Mm.
with all of this. And it's very encouraging that our society and our communities have become so cohesive around that.
Mm.
Yeah.
Yeah. Yeah. So, continuing on from that, I suppose, is there a worry that people who have other health conditions at the moment sort of are avoiding the hospitals, and that there's going to be like waiting lists building up, and so sort of after the restrictions become a bit less strict, that a lot of people are going to sort of overwhelm the hospitals in some ways. I don't.
Yeah, yeah, and the GP. So you
Mm.
perhaps should
Yeah.
talk to Sally
Yeah.
about this. But I think GP practices are seeing less patients at the
Mm.
moment.
Yeah.
The emergency departments are seeing less
Mm.
patients, and our own hospitals have vacant beds in them.
Yeah.
So there are less people in hospital, not just because of um, decreased what we call elective surgery, but other conditions just aren't
Yeah.
turning up.
Yeah.
So we're seeing a decrease in the diagnosis of things that shouldn't be necessarily related, things like strokes.
Mm.
We're seeing less of them,
Mm.
and there's no really good reason for that, except that some people might not be presenting for care or
Mm.
diagnosis because of them.
Mm.
Um, it may be that the background spread of other viruses, colds, influenza, which we know is also reduced,
Yeah.
may reduce the trigger for some of those other diseases. But yeah, it's almost certainly true that we're delaying the diagnosis of something. So there's now data that shows that cancer diagnoses have dropped
Mm.
dramatically. And
Yeah.
it's probably not because cancer is less,
Yeah.
but people are probably not having their other things like cancer diagnosed. It's likely to mean that if they then get diagnosed in 6 months' time, some of those will be more advanced
Mm.
than if they weren't seen too early, which means that there's a burden, if you like, a mortality in healthcare sense related to COVID of other diseases simply because they're not getting the attention that they mean. And that will carry with it a burden on society, a financial burden, economic burden, productivity burden,
Mm.
a mortality that is probably at least equal to the mortality that we're seeing from the coronavirus, even in places that have a very, very large outbreak of coronavirus. And we won't see the results of that for
Mm.
probably some years to really measure
Yeah.
impact, but it's certainly
Mm.
likely. And so our messages when we're talking about healthcare to people is that they must continue to have their own healthcare
Mm.
addressed, because otherwise the ramifications will probably, will outweigh the benefit that we'll get for the society by protecting people from coronavirus.
Yeah. And if a lot of people are really focused on coronavirus, then they might like be shocked by other things that come out of it, like people, yeah, having other health problems, I suppose.
Mm, yeah.
Yeah.
Okay.
Um, Yeah, so it sort of seems like the media. This is a bit of a change of topic, but it seems like the media is sort of only interested in covering the health problems that come with the protests that have been happening around the world at the moment. But I suppose, what sort of like response do you have to the protests on a personal level? I suppose. Mm,
Yeah, I mean, I'm very tied up in healthcare, and
mm,
a lot of my work at the moment is in planning for the worst for the COVID response, whilst hoping for the best.
mm,
So our own response to that is has had a massive demand on increasing our capability in ICU. So I'm very focused on the coronavirus and its spread and its containment and the community measures. I'm very nervous about the frustration that's now being, um, demonstrated by people who've now been, restricted in their movement and activity for some months. And so I'm aware that that frustration can be manifested in all sorts of ways. And interestingly, perhaps constructively, to support, very, uh, very laudable, very good um, concerns like the Black Lives Matter movement. But to say that the Black Lives Matter movement has an urgency about it now that it didn't have in November last year is clearly not true. You know, um, and so I wouldn't choose now to say that we need to have an uprising. I would be very nervous about that because there's a contradiction within that that says, well, somehow or other, Black Lives Matter, and Black Lives Matter more than the very Black lives that would die with COVID. In fact, we know that um, genetics of Black people seem to predispose them to death from coronavirus
mm,
more than other people. And so the irony there is in protesting, we're exposing people that might spread the disease, which might actually lead to more Black deaths. And so,
mm.
my view on those is that it's a laudable, very laudable reason, but it wouldn't necessarily be the timing for me. I think we've got a little bit yet to learn. We've seen the release of a number of restrictions all at once, and we know with the timing of the virus that we would really expect not to see changes for a couple of weeks in terms of measuring numbers of people with infections, because it's exponential, and the average incubation period is around 5 days. You need to double and then
Yeah,
double and then
yeah,
double and then double before you start measuring real numbers. And it seems that probably the majority of people who get this infection are either don't have symptoms or have very minor symptoms.
mhm,
So a lot of them will never get diagnosed and may well spread the virus. So it may be a month or two after significant contacts that we get an outbreak. And I think to then suddenly go from being almost locked down to having meetings of thousands of people is sort of too much at once, because you can't contact trace when you're dealing with thousands of people,
yeah,
unless everyone has the app, right? In which case you can, download whoever was in contact, but that's not the case.
mm,
And that then means that we're at risk of introducing a massive outbreak, which will have a big effect.
mm.
It's a long-winded answer, but
Yeah, yeah.
yeah.
All right, and just to wrap up, maybe a bit less of a tough question, but have you been doing anything sort of creative in this time that you've sort of found that's been good, like that's been different, I suppose, to your normal routine of things with your family or at work or anything like that?
Yeah, I mean, I keep busy, and
Mm,
so in part of that busyness, I've had, I've been doing a reasonable amount of cooking, fair bit of running. We've got a family property that we get out to, so we've been up there a bit, and that means the boys have had a chance to, be restricted to moving only in about 800 acres, which is a reasonable thing to be restricted in when you're
yeah.
having to be locked down. And the thing is, we've freed up some of the extra time that was, the
Mm,
sporting commitments or the other commitments that are kind of that regular um, amount of time that you have. Um, they're probably they're probably the biggest changes for
yeah,
us.
yeah.
Mm. And we haven't been camping, so as you remember, we were actually meant to be about Cairns at the moment on a
Yeah,
16-week trip around
yeah,
Australia, coming up to the last 4 weeks now. And so we missed that. So we're still hoping that we might be able to
yeah,
do that next year, and looking very much to going camping again.
yeah.
We've sort of missed that.
Yeah, it seems like a lot of people have been impacted in
Oh yeah,
holidays and travel
yeah. It's a
really.
small burden
Yeah.
compared to some people's
Uh,
impact.
yeah. Yeah.
Yeah,
Yeah. Anyway, thanks
yeah.
very much for agreeing to be interviewed
No problem.
for our
Anytime,
first
Jolly.
episode of this podcast. Yeah.
Pleasure.
Yeah. So I hope you all enjoyed this first episode, and I'd love to hear any of your feedback on the podcast itself, but also on what Owen said, what you thought of it. Anyway, thanks for watching.